Craig Earle, who received his bachelor's degree in science in 1987, MD degree in medicine in 1990, internship, residency, and chief residency in internal medicine, ending in 94, 2 years of fellowship in oncology, ending in 96, all at the University of Ottawa, as well as a master's degree in epidemiology in 1998. He's currently a associate professor at the University of Toronto, staff physician at Sunnybrook Hospital, senior scientist here at ISIS, and a director of health services research at Cancer Care Ontario. Lots and lots of accomplishments. I was particularly impressed by multiple prizes for research excellence, over 120 Medline articles. He sits on the editorial board of the Journal of Cancer Survivorship, and it all started with a resident research award over 17 years ago, and entitled Reducing Endotracheal Tube Resistance by Modifying Outlet Geometry. You've come a long way.
Well, actually, that was very cool. we were in a wind tunnel at NRC with different designs of endotracheal tubes, testing the resistance and stuff. It was actually very cool stuff. Well, for air, I'm not sure. That's a great idea. Which is why I moved into other things. So thank you very much for having me here today. I'm going to be talking about an issue that comes from more from my recent past life, which is issues around cancer survivorship and how to manage them, and particularly around models of care for cancer survivors. Now, first of all, disclosure, I have no disclosures related to this. So first of all, why do we care about this? Why is it important? Well, really, it's an issue of numbers. This is to do with cancer incidence, so they're increasing absolute numbers of cancer patients. This is projected for Ontario. And what you see here is that the major reasons are population growth and the aging population. Cancer is a disease of older people, so as you have more older people in your population, you have more cancer. So going from 2007, where in Ontario, 172 people in Ontario per day diagnosed with cancer, by 2017 that'll be 228 people per day. So this is a big, important disease. Well, if you have more people developing cancer, then you will also have, in absolute numbers, more people surviving and becoming cancer survivors. So this is data from the United States that basically shows in the United States there's now over 12 million people with a personal history of cancer. And in Ontario, in the next 10 years, they're projecting to see a 40% increase, such that by 2017, there'll be 500,000 people in our population with a personal history of cancer. So a lot of cancer survivors. Now, why are there so many cancer survivors? It's not just the issues of population growth and the aging population, but also we're doing better with cancer. So earlier detection, especially for some like breast cancer, and then new drugs and technologies. We're actually curing more cancers than ever before. And so along with these graphs showing more patients with cancer, more patients surviving cancer, more cancer survivors, there's also been a ramp up in the interest paid to cancer survivorship and the issue. If you go back 10 years or so, it was really something that, at least in the adult population, not many people spent very much time thinking about. Now it's become a major focus for a lot. So how are we taking care of cancer patients? Well, this is a map of Canada showing that follow-up care varies quite markedly, and in particular in Ontario. So these are just a few categories of how we care for patients after they've finished their primary treatment for cancer. So in the periwinkle squares, we have transfer of care to primary care physicians, family doctors, which is something that within Canada there have been several pushes based largely on data from studies that Eva Grunfeld has done to have this model of care. In the black circles, we have the usual type of care, which is follow-up in cancer centers. So oncologists following patients forever in their cancer centers. And then in the triangles, you have variable practices where there's maybe not really a policy and some sort of a mix. And so you see in Ontario in particular, there's probably more variation than in other provinces. Well, that would be okay if everything was going well. But the problem is, in general, there are problems with the status quo with these different models of cancer survivorship care. And the three that I'll talk about today are, first of all, dissatisfaction with care, variability in the quality of care that cancer survivors receive, and looming workforce issues that we're going to have to face.
Very